As I grew up as a child, I remember hearing that mantra, if you don't beat me, you don't love me. And I think that some of y'all could relate to that. Maybe you might have heard that from your peers, you might have heard that from family members, you might have heard that from neighbors. And something that we would discuss later on in the presentation, why persons may, women in particular, may feel that way. Why a woman feels that, she has to stay in a relationship that is abusive. I'm from the Caribbean HIV and AIDS Alliance, and CHA is an original non-governmental organization, CHA for short. So if you hear CHA, you're talking about the Caribbean HIV and AIDS Alliance. It was formed basically to build and strengthen the HIV response within the Eastern Caribbean. It's headquartered in Trinidad and Tobago, with country offices in 7 Eastern Caribbean countries, namely Antigua and Barbuda, Barbados, Dominica, Grenada, St. Vincent and the Grenadines, St. Kitts, and St. Lucia. While what we're currently focusing on is called the Eastern Caribbean Community Action Project 2, which this is the second phase, and its primary focus is to increase access to HIV and AIDS prevention care and treatment services to the most at-risk population within the Eastern Caribbean. What CHA is focused on, it's really a true peer outreach model. That is how it's designed. That particular project is designed to use community animators, and we have 3 of them here with us. Just indicate by hands. All right. And the community animators are really outreach officers, and the outreach officers are used to target clients with behavior change communication messages. And our targets are sex workers, transactional, as persons who engage in sexual activities for goods and services, commercial, persons who engage in sexual activities for money, men who have sex with men, and persons living with HIV. These are our main targets. We do understand, though, to target those populations, we need to target the entire population because of the whole social context of Grenada, and they are hidden within the population of Grenada. So we do have to sometimes target the entire population to reach the target that we need to reach. It's our objectives. Objective 1, reduce vulnerability to HIV through access to comprehensive prevention services. And this is a whole combination approach. We may do things like edu-drama, which is we're currently on project now with the Heritage Theatre, or we may do group activities, or we may just go to places like Moonlight City, Grenville on a Saturday night, Esplanade Mall. It depends on what's going on, and we target persons in those locations. All right, objective 2, to increase access to stigma-free prevention, treatment, and care services for the most at-risk population and persons living with HIV. And basically how we try to do that is develop and promote certain activities to engage persons to uptake HIV counseling and testing. We've done that, we've worked along with the Ministry of Health to do that, and our most recent one was in December in Moonlight City. Usually they go have a Thursday night line, so we went there, we did testing, with 30 persons came on board with no advertisement to get tested because the services was there. And that's our plan, to bring the services to the persons where they're at the time. Objective 3, strengthen capacity and capability of national partners and civil society organizations to ensure quality service and improve delivery. We've provided small grants. Ms. Charles would have indicated earlier on that we provided grants to Grencha. We're in process that we've provided to Gino as well. Gino had a gender-based violence and HIV peer educators project in Simon of 2012 to 2013 here. And those persons are now working within the communities, working with HIV prevention, sharing the information, advocating to their peers. So we see a little roadmap to sustainability. Target behavior address. So the community animators would go to the communities and address some of these standard behaviors, HIV and other STI awareness, safer sex strategies, condom negotiation, how to negotiate safer sex, partner reduction, because we have the tendency of persons having more than one partner and so on. So we do that as well. Personal risk reduction, HIV testing, as I alluded to earlier on. We talk to persons telling them that knowledge is power. Knowing your status, if you know your status, then you will be able to make good decisions. Other target behavior, sexual reproductive health, pap smears, swabs, stigma and discrimination, empowerment, persons who may have been abused, gender-based violence, self-acceptance, specifically with the men who have sex with men, accepting themselves, accepting who they are. If you accept who you are, then you'll be able to make better decisions for your life. All right? PMHIV, coping, disclosure, whether it's good to disclose or not, access to health care services, reinfections, treatment adherence, and we refer persons to Ministry of Social Development, the Grenada Planned Parenthood Association, NICU, and other places as well. Gender-based violence. I felt that I needed to include some information there as well, and at some point we'll show a little bit of the linkage. Domestic family violence, intimate partner violence, the dimensions, its ranges. Some of the persons already spoken about it. Physical, emotional, sexual. The perpetrators can be both male and female, but sometimes we focus on the male. We say the man do this and the man do that, but we have to be cognizant that women can also be violent, both physical and emotional. Control, basically that's what it is, control, power. I am the one in charge, and I want to do what I want to do, and not being cognizant of other persons. We have to be and realize that we do not live in a bubble. Alright, so why focus on GBV? Intimate private partner violence, it affects the psyche of persons, individuals and families. And as such communities, it affects us. Because if you're living in a community that is 50%, 5%, 2%, have some sort of violence, and we live in communities, so we know that there are violence. It might be emotional, it might be physical, or, it would affect you. If you're a teacher, a child comes to school who has experienced rape, incest, or anything of this sort, the child would not be able to sit in that classroom and learn. There's no way possible. The child is thinking about how tired I am, what happens wherever, and other side effects. We have to be cognizant of that. The rationale of GBV and HIV linkage. HIV transmission, the risk increases during violent sex, and Mr. Marshall and others might have indicated earlier on that. Such as rape, the bruises, causes forced by forced sex, facilitate the entry of HIV. Fear of violence of disclosing, of saying that, telling my husband or my wife that I'm positive. We don't know what reaction we would get from that particular partner or families, or how they would treat us, stigma and discrimination. So we have to be aware of all that as well. Successes and challenges in our job. Successes, we have clients that have taken over for us. So we see that as a success. Persons have gone, get tested, and they found out their results. And we're hoping that they continue on the path that we started. Some clients have changed their behavior, which is good. Some clients said that they use condom continuously, they advocate to their friends. Community animators are exposed to things like coping skills, motivational skills, self-awareness, pessimism, optimism. So we're hoping that the community animators, when they're exposed to these things, and even this training here, would be able to transfer it to their clients, and who will be able to transfer it to their friends as well. We distribute condoms, male, female condoms, dental dams, and some people may or may not know what dental dams are. I have some in the packet there.
You have a female condom? Because a lot of us female don't know what that looks like.
We could show it afterwards. I think it's in the box.
This is a dental dam. It's a thin piece of latex used for oral sex. It could be used both on the male and the female. I like to stress to my clients that it's very thin, so you do get the feeling and the sensation when you use it, and it's flavor. So I like to stress to them, try and experiment and try to spice up things rather than just stressing on how protective it can be. And incentive to get them to use it is to tell them how fun and exciting it is to try something new. So this is what it looks like. Yeah.
Sex is in our communities, people. Slowly, sex is in our communities. And if we don't talk about it, people won't be able to do what they're supposed to do. People won't be able to say, no, I'm not ready for it, because we're not talking about it. And that's one of our main problems. If you speak about it, then you have to tell your children, wait until you reach a certain age and talk about it and why you should wait and that sort of thing. Nothing is wrong with abstinence either. Challenges, the system. The social and health system has insufficient human resources, and Mr. Marshall alluded to that earlier on. They just can't meet all the persons. They can't. It's not possible. We found out that there's one social worker per parish, and there's also one social worker between St. Mark and St. John. Only one, and then one in every other parish. If we, for instance, refer someone to a social worker, then that person may just say, well, he's not following up with me, or she's not following up with me. But God forbid, these people don't have the energy all the time to do it. The system is not conducive for allowing, for us to move on. All right? Clients do not believe in the system. Confidentiality, real or perceived. Sometimes it's real, because we have instances where we heard certain things and we know that sometimes it's real, but sometimes it's not. And the majority of times, I believe it isn't. But because Mr. Hopkins said that his status was exposed, and sometimes Mr. Hopkins told his wife, who told his friend, and who told his sister and something, and they just assume it's just a nurse or a doctor who did it. We have to be cognizant of that as well. And attitudes of some persons in the system, due to little or no, we feel no debriefing services for professionals. After you've spent a day in the office or in the field, and you've heard all the stories, and there's no one to share it with confidentially, then you need, who would you talk to? Maybe your partner, when you go home, sleeping next to the person. Maybe your priest, maybe your pastor, maybe you would talk to, you need some sort of avenue for you to be able to share those stories confidentially. All right? Okay, I'm coming back to now. If you don't, what did I say again? If you don't hit me, you don't love me. And one of the things that we felt may sort of cause that is people self-awareness. Persons are not aware of who they are. They're not aware of the power he or she possesses to do positive things. I have this quote there by Plato. All learning has an emotional base. As we grow, we learn. As we learn, we grow. Self-awareness, being aware of the traits, feelings, and behavior of persons. Knowing yourself, knowing how you affect others, and knowing how others affect you is very important as well. Because if I'm going to a counselor and I saw the expression of that person's face, that alone might turn me off. And sometimes the counselor is not judgmental, but we have to be cognizant of where we are now, and when someone come to us for assistance, how we express ourselves to that particular person. Because she has long hair, the sexy little dress, high heel, you think she's a sex worker. No, the person may just like to look sexy. Necessarily mean the person is a sex worker, you understand? The person may be like a guy, the person may have effeminate qualities. They may look like, somewhat of a woman. You might say the person is gay. That doesn't necessarily be the case. The person could be gay, and if they are, so what? What are you here for? Why are you here? What services are you providing? If the person is gay, for instance, how are you going to provide that service? Are you going to be different for somebody who is gay and who is straight? All these sort of things that we have to take into consideration.